Good evening, everyone. Welcome to our final assessment for Module 4 for CAA aspirants. Tonight, we shall take up gallbladder channel of Foot-Jueyin and the liver channel of Foot-Jueyin. Okay, so the gallbladder channel of Foot-Jueyin is also known as the leg lesser yang gallbladder channel. So lesser po ang yang niya. So let's discuss the primary channel first. Can you all hear me? Yes? Okay,
Yes, Doc.
Yes, Doc.
thank you. So this primary channel of the gallbladder starts at the outer canthus. I think you know where the outer canthus is of the eye, and it traverses the temple to the point, what do you call that point? Sanjiao 22, no? Or triple burner 22. It then ascends to the corner of the forehead. Okay, let me use a pointer. So, andito po yon. Outer canthus. Okay, then it traverses the temple to the point Sanjiao 22. And then it will ascend to the corner of the forehead where it intersects with the stomach 8 before it descends behind the ear. From here, it will proceed along the neck in front of the Sanjiao channel, crosses the small intestine channel at SI17. Then, at the top of the shoulder, turns back and runs behind the Sanjiao channel to intersect the Du channel, or the governing vessel channel, at Du14 on the spine. I think every one of you, all of us are now familiar where Du14 is. Finally, the channel will turn downward and into the supraclavicular fossa, so pababa siya. One branch of the main channel emerges behind the auricle and enters the ear at Sanjiao 17. Emerging in front of the ear, this branch will intersect the small intestine channel at stomach 19 and the stomach channel at stomach 7 before it terminates at the outer canthus. Okay? Another branch separates at the outer canthus and then proceeds downward to stomach 5 on the jaw. Okay? And then crossing the Sanjiao channel, it returns upward to the infraorbital region. So that's below the orbit, before descending again to the neck, where it joins the original channel in the supraclavicular fossa. From here, it descends further down into the chest, crossing the diaphragm and then connecting with the liver before joining its associated organ, which is the gallbladder. Okay? And so tumutuloy po siya sa gallbladder. Then continuing along the inside of the ribs, it emerges in the inguinal region of the lower abdomen and winds around the genitals, submerging again in the hip at gallbladder 30. There's another vertical branch, ang daming branch, that runs downward from the supraclavicular fossa to the axilla and the lateral aspect of the chest. It crosses the ribs and intersects the liver channel at liver 13 before turning back to the sacral region where it crosses the bladder channel at bladder 31 to bladder 34. Then this branch then descends to the hip joint and then continues down the lateral side of the thigh, no? Okay, and the knee. Then it passes along the anterior aspect of the fibula to its lower end. So here it crosses in front of the lateral malleolus and traverses the dorsum of the foot, entering the seam between the 4th and 5th metatarsal bones before terminating at the lateral side of the tip of the 4th toe at GB44. Finally, we have a branch that separates of the dorsum of the foot at GB41, and then it runs between the 1st and 2nd metatarsal bones to the medial tip of the big toe, then crosses under the toenail to join with the liver channel at liver 1. Now, according to chapter 4 of the spiritual axis, this channel, the gallbladder channel, connects with its Pussy point, the lower uniting point, no? The gallbladder 34. This channel is associated with the gallbladder and it connects with the liver. That is why if you have a patient who has liver yang rising, you should always sedate the gallbladder 34. Okay? It is also it also is joined directly with the heart. Okay. So then let's talk about the symptoms associated with the channel, the external course of the channel. So magkakaroon po ng alternating fever and chills, and I think this, you know that this is a very important characteristic of we call this the hinge channel, no? Shaoyang po siya, no? Gallbladder. And may headache, and then the complexion would be ashen, okay? Medyo maabo yung complexion. There will be pain in the eyes or jaw, swelling in the subaxillary region, scrofula, so may mga bukol-bukol dyan. You can have deafness and then pain along the channel. So for the symptoms associated with the internal organ, of course, there will be rib pain, bitter taste in the mouth, and chest pain. So grabe-grabe na yung yang. In fact, when you have liver fire is translated as too much yang na, no? Kaya nag-spill over na po siya sa gallbladder. So you'll have bitter taste. Now let's go to the luo connecting channel of the gallbladder. Okay, all you have to remember here is the point GB37, because the luo channel separates from the primary channel at this point, gallbladder 37, on the lateral aspect of the lower leg, connecting with the liver channel at liver 3. So if you remember, these are very, very important points. And your patient will love you for really needling these points. The channel proceeds downward and it disperses over the dorsum of the foot. So what are the symptoms of excess energy in the luo connecting channel? So excess, you will have fainting. Now, what about symptoms of deficiency of the luo connecting channel? So pag deficient, it should be weak and flaccid muscles of the foot and making it difficult to stand. So nanghina ka na, hindi ka na makatayo. So most likely we will be looking at the possibility of a very weak luo connecting channel of the gallbladder. Next, we go to the divergent channel. After diverging from the primary channel on the thigh, so this channel crosses over and enters the lower abdomen in the pelvic region, where it converges with the divergent channel of the liver. So friendship sila ni liver. Divergent channel ni liver, divergent channel ni gallbladder. From here, it crosses between the lower ribs, connects with the gallbladder, and then spreads through the liver before proceeding upwards across the heart and esophagus, and then dispersing in the face. Here, it connects with the eye and rejoins the gallbladder primary channel at the outer canthus. So, napaka-importante po niyan. In fact, tapping just this area is very, very, it can help the patient a lot, okay? Lastly, we have the muscle channel or the sinew channel of the gallbladder. So, where does this start? It begins at the fourth toe, and then it joins with the external malleolus, and then it proceeds up the lateral aspect of the leg, where it connects with the knee. A branch starts at the upper part of the fibula and then ascends along the thigh. One of its sub-branches travels anteriorly, joining the thigh above stomach 32. Another sub-branch travels posteriorly and joins with the sacrum. Okay? So the main channel, if you remember the main channel, very easy to remember, proceeds upwards across the ribs and anterior to the axilla, connecting first in the breast region, and then above the collarbone. Another part of the main channel extends from the axilla upward across the clavicle, emerging in front of the leg greater yang channel. Then it continues upward behind the ear to the temple. From here, it continues to the vertex where it joins its bilateral counterpart. So yung sumasakit yung tuktok ng ulo, that's very liver yang or the gallbladder na is affected. No? So at the vertex, the gallbladder sinew channel will join its counterpart, yung sa side, bilateral counterpart. A branch descends from the temple across the cheek, okay? And before it joins with the bridge of the nose. So kung napapansin nyo kung nagagalit, medyo pumupula yung bridge ng nose. Ay, ako pala. Napapansin ko yan. Okay, so if one day you got so angry, namula yung ano mo, so blame it on the too much liver yang. So it has affected the gallbladder so much already because gallbladder is the young partner of the liver. Okay? And then we have a sub-branch that connects with the outer canthus. So what are the pathological symptoms of when there is an issue with the gallbladder sinew channel? So magkakaroon ng strained muscles of the fourth toe. So if the patient would tell you, sumasakit yung, ano nga yung, yung fourth toe niya, so definitely it's the gallbladder, na strain yung muscles, no? Or there is straining of the muscles of rotation on the lateral aspect of the knee. Kasi nasa lateral aspect yung ating gallbladder sinew, no? And inability to bend the knee. So hindi ka na maka-bend, hindi ka na makapag-squat. Okay? Muscle spasm in the popliteal fossa, strained muscles of the pelvis, strained muscles of the sacrum extending upward to below the ribs, and pain in the hypochondria. Okay? So yon. Basta lahat ng pain that you can think of, blame it on the gallbladder sinew channel. So let's take a look at the outline or review of the points. So tonification point is gallbladder 43. Sedation point is gallbladder 38. So what do you think is the horary point of gallbladder channel? Anyone? Anong element ba ang gallbladder? Di ba wood? So hanapin niyo po yung wood point ng gallbladder channel. Who can answer? What's the horary point of the gallbladder channel? Bilis. The third point, di ba? Third point ba? Yeah, 44, 43. Okay, who can answer?
41, Doc.
41. Ako, ang galing talaga. Okay, third point. So, yes. So, if you have issues with the eyes, you use gallbladder 1. So, can anybody point to me where gallbladder 1 is? Nasaan si gallbladder 1? Dali lang naman natandaan ito. Okay. Basta may issue sa eyes, you use the GB1. And then,
Outer canthus.
the outer canthus. Yes, lateral or outer canthus. If you have issues with the ears and the jaw, you use gallbladder 2. And kung may headaches or insomnia, use GB12. And GB14, this is just like here. And this is my favorite for frontal headache. And if you have issues with the eyes, lalo na pag sumobra na yung kababasa mo, naduduling ka na sa binabasa mo. Okay. GB20, a very favorite point, is the major point for headaches, for the eyes, the ears, hypertension, dizziness, both internal or external wind. So by this time, I'm sure you already know the difference between the two. GB21 pulls energy down. Ganun lang o dito. Yan. So those with issues with the neck, trapezius problems, okay? And by the way, you're going to be, I hope you will be familiar with the trapezius muscles, sternocleidomastoid, and all those muscles there, the deltoid. So you have to start reviewing tonight, okay? Reading pala. Okay, answer all the assessment questions. Menses, contractions, breast issues, and also hemiplegia. Now, for gallbladder 24, we use this for gallstones. Kasi masakit, no? You can probably temporarily relieve the pain. For those with bitter taste, saka mag-jaundice na yung mukha or jaundice na yung mata. GB25 is the front view point of the kidney. Gallbladder 25. Actually, it's supposed to be the flank area, no? Okay, alam na alam yan. Pag meron kang kidney stones, masakit po yan dyan. And there will be bitter taste, jaundice. GB25 I'm sorry. We were talking about GB25 as the front viewpoint of the gallbladder, no? And also for the adrenals, okay? Yung masyadong stress. Alam niyo ba yung adrenals are just located on top of both kidneys. So there are two adrenals, one on each, one adrenal on each kidney. And every time you're stressed, it actually affects your cortex, no? Kaya tumataas yung ano mo, glucocorticoids. So tumataas yung sugar. So bawal mas stress. And you know what I've noticed? Once they find out that their blood sugar is high, kasi ang tigas-tigas ng ulo, lalong tumataas yung sugar. Kasi, so yun. So you might want to needle GB25. It also builds the kidneys. And you know, there are a lot of people na nakalimutan na natao lang sila. So they really work until hindi na nila kaya. That is not a very good idea, no? Low blood pressure, you can use GB25. Next, we have GB26 for damp heat in the lower burner. So if you look at the tongue, there will be usually ang one side lang po of the, like, sometimes it's the right side, right ba? Okay, that is thick ang coating. So that's already dampy. So you might want to use GB26. And also for those with vaginal discharges, so that's very dampness and heat, gynecological issues, distended abdomen. Then GB27 is for the lower burner. So pag nakita mo makapal yung coating po sa lower burner sa tongue, you might want to needle GB27 at saka kung may endometriosis. Next, hip pain, gynecological pain, you'll have to use GB29. And your favorite, ang dami po may mga sciatica ngayon, no? So you need to really master your anatomy. At saka madali lang to, GB30. All you have to do is look for the para siyang dimple. So dapat naka-expose yung hip ng pasyente, no? So for hip and back problems, you would, and this is the main point for sciatica, GB30. Ako naman, for those patients who are nahihiya, I needle gallbladder 30 on the ear. So we have a book for that. If you want to visit lab, meron pong original copy si Dr. Palangka to. So instead of using GB30, which is a bit, medyo na-embarrass kasi iba pag, pag naguhubad kasi kita mo. So ako, I use GB30 on the ear. Okay? Then we have, for the legs, GB31. All you have to do is just ask the patient to stand, and then kung saan nag-end yung kanyang, yung kanyang middle finger, yun na po ang point. Okay? Saka you try to check by probing. Medyo tender siya. The very famous gallbladder 34 for muscle, tendon, and joint problems. And this is also good for the shoulder. So if you are very interested in studying balancing technique, we can always ask Dr. Gavino for the lecture. Are you familiar with the balancing method? Yes. Knee pain, back pain, gallstones, constipation, sciatica. So meron na tayong dalawang points na alam for sciatica. GB30, GB34. Actually, GB34 is just kalinya lang po ni spleen 9. No? So for those who are having so you need to be very precise with the location. So kung hindi ka masyadong sure, basta ka-level lang po ni spleen 9 sa medial side, no? It's GB34. For gallbladder 37, for eye issues and also the cough. So this is a local point for cough issues. And migraines, can you imagine you use GB38 for migraines? Magugulat yung pasyente, masakit yung, may migraine siya, bakit doon mo tinusok sa GB38? Or you may also want to use GB38 on the ear. Yeah, you will be very, very surprised that it really works fast. GB39 for the immune system, bones and joints, and for neck pain. So again, balancing, specific for neck pain po ang GB39. So, lalo na yung parating naka-computer, lalo na masyadong mababa yung screen, yung kanilang monitor, no? So, kailangan mong itaas. So, you might want to needle GB39. And also when you have sciatica. So, we have already 3 points for sciatica. You don't have to needle all of them. So, kung gusto nyo si GB30 lang, pwede rin si. Or what you want is to maximize. Like, you have to consider all the other problems para one point hits all, no? Yon. Kung may neck pain, then may sciatica din. So you might want to use GB39. At saka you might want to strengthen the immune system. Migraines, inflammations. Gallbladder 40 is very specific for rib pain and also the eyes. GB41 for breasts, painful menses. GB43 for headache, tinnitus, and dizziness. And lastly, GB44, headache. So for those who are enrolled in the fifth module, you should know the indications of the 5 shoe points. Okay? Particularly, yung parati natin ginagamit, yung Jingwell, yung Ying Spring, at saka yung Hulsey points. Okay? Now let's call on someone to give us the answer. So, okay, sino pa ba hindi ko narinig? Okay. Let's call on... Okay, Sir June Azariel, did you study?
Medyo po, Doc.
Ay, ano medyo dapat? Yes na. Okay. Can you
So,
take...
medyo na ano ko na anxiety ko ngayon eh. Kinakabahan.
Nagkaroon ka na anxiety? Grabe. So,
Opo, Doc.
okay. Sige. Gawin natin malala yung anxiety joke. Okay, number 1. Answer for number...
Wait lang po. Ano po ba sa number 1? Wait lang. Sandali po. Wait lang. Okay po. Number 1 po is, ang sagot ko po, Doc, is GB34 po.
No. I'm sorry. Number 1
po?
is gallbladder 20. Kanina mo siya i-prepare.
Ay, sandali. Wait, mali
Because
yung
took this up
nagawa
earlier.
ko. Wait po. Wait lang. Ay mali yung Doc.
Are you prepared, sir? Okay, medyo mauubos yung oras natin, ha? Can I call you back later? Okay, let's call on Miss Annalyn. Ma'am Annalyn, how is B call?
Yes po. Apo.
Okay, did you study well?
Oo din po.
Good. Okay,
Yes po.
so I'll give you only 3 minutes to answer all 11. Joke.
So for number 1, GB20. So my answer is, it disperses wind, eye diseases, common cold, headache, stiff neck, vertigo, and hypertension. That is letter C.
Okay. Anong
Okay.
precaution? What particular, like, what are we so worried about here? Paano yung needling mo dito?
Yung needling po, medyo 0.5 to 0.8.
So not too
Tune
deep.
towards po. Not too deep.
Where should it point?
Towards the tip of the nose.
Okay. So naka-oblique, no?
Yes po, oblique.
Are you going to tilt the needle upward?
Depende po kung ano.
Okay. Kakatakot. Remember. Okay. Anyways, wala pa tayo. We will take that up when we discuss anatomy, no? The wrist involved. Okay. Number 2, Ma'am Annalyn. What's your answer for GB21?
GB21, my answer will be letter I. It communicates with the yin organs, fasciitis, hemiplegia, pushes energy down.
Very good.
So,
good. Wow, you are so prepared. I hope you do not commit a mistake. You were given a week to study, di ba? Number 3,
yes,
gallbladder 24.
Number 3, GB24, my answer will be letter D. It drains damp heat, cholecystitis, jaundice, hepatitis.
Okay. Yeah. Ma'am Annalyn, let's practice pronouncing cholecystitis.
Cholecystitis.
Yeah, cholecystitis. Very good.
Opo.
Letter number 4, GB25.
Number 4, GB25, letter K, builds kidney chi, nephritis, and intestinal hernia or lumbago.
Okay. Ano pong category ang gallbladder 25? Why do we use it as a point to build the kidney?
GB25 po, it's the front
Classification.
move point.
Very
It's
good.
the front move point of the kidneys.
Very good. Wow, I'm so proud of you. Okay, number 5. GB20.
Number 5, GB26. My answer is letter J. It alleviates damp heat, endometritis, cystitis, profuse blood, and leukorrhea.
Are you not going to consider sciatica? Wala pong, ano answer nyo po for number 6?
For number 6 po, letter E. Sciatica. For number 6, GB30, letter E.
Letter E. Very good.
Yes po, sciatica.
Wow. Do you, can you share with us yung experience mo? Do you use this point on your patient?
Mas common ko pong gamit yung GB31. Pero
Ayun.
minsan nagamit din po ako for sciatica, yung GB30. Pero common na gamit ko kasi GB31.
Wow, very
Yung sa tip of the middle finger.
Yeah. Number 7,
Apo.
Ma'am Annalyn.
Number 7, GB34. My answer is letter A. It's the meeting point cell and tendons, hepatitis, cholecystitis, and habitual constipation.
Okay. Marunong ka na mag-locate nito, no? Mag-needle.
Opo.
Easy.
It's the
wow.
easy point. Opo.
Very good. Okay, number 8, GB38.
GB38, my answer is letter H, sedation point for migraine, hemiplegia, and excessive perspiration.
Okay. If GB38 is a sedation point, what point is the tonification point?
Dali po. Tonification point po, it's GB43.
Okay. Thank you. Wow. Number 9, GB39.
Number 9, GB39, my answer is letter F. It clears marrow heat, stiff neck, migraine, boost immunity, and for broken bones.
Yeah. Actually, we read somewhere, I don't know kung nabasa nyo din, that it can actually facilitate the healing of broken bone. GB39.
Apo.
And if I'm not mistaken, si Ma'am Lynn had a very good experience with this. I don't know. I think it's GB39 yata. Okay. Number 10, GB41.
GB41, letter B, it regulates girdle channel, mastitis, headache, vertigo, and irregular menses.
Okay. So siguro you're very familiar with the girdle channel, no?
Yes po.
Okay. Number 11, GB37.
GB37, the answer is letter G. It regulates the liver, night blindness. It's a good point for cataract and migraine.
Yeah, very good. Thank you very much, Ma'am Annalyn. Good job.
Thank you
Excellent
po.
job. Wow, talagang prepared na prepared. How is Bicol?
Okay lang po. Maganda ang panahon. Tigil na yung ulan.
Hear that. Wow.
Yes po.
Ingat po. Maraming salamat.
Thank you po.
Thank you. Let's call on somebody else. Okay, Sir June Azariel, I presume ready ka na?
Doc, mali po kasi yung nagawa ko eh. Kaya medyo nalilito po ako.
Baka gusto mo sagutin yung alarm point for gallbladder.
Oo, sa alarm point po. But doon po medyo may sagot ako dyan. Wait lang po ah.
Dapat nilagay mo na sa utak mo yung sagot. Paano yan?
Ano na ba tayo? 11, 12 na po. The alarm point po ng gallbladder is GB 24 po.
Okay, very good. Alarm point for the kidney.
GB 25 po.
Very good. Very easy. Starting point of the channel or the girdle channel.
GB 26 po.
Galing. Oh, see, you ready pala, no? Next,
Hindi po,
meeting point
mali
for
po kasi nagawa
tomorrow.
ko.
Meeting
Oh,
point
Doc.
for tomorrow and Triyang meeting point, which is very good, which is the reason why if you have broken bones, madaling mag-heal if you needle this point.
Opo.
So your answer?
39.
Okay, GB39. And finally, master point of the girdle channel?
41.
Wow, congratulations, Sir June.
Doc,
I hope
pass.
you're not looking at your código now.
Doc,
Okay, thank you very much. Congratulations. Okay.
Thank you po,
I
Doc.
hope inspired to work harder.
Okay,
Next, we go
you
to,
po,
thank you
Doc.
very much. Next, we go to the liver channel of Foot-Jueyin, leg absolute yin liver channel. Okay, let's talk about the primary channel first. So as you can see, the liver primary channel begins on the dorsum of the big toe, continues across the foot to a 0.1 unit in front of the medial malleolus. Then it proceeds upward to spleen 6, where it intersects the spleen channel. Remember, spleen, liver, kidney. Okay. From here, it continues up the medial aspect of the lower leg, recrossing the spleen channel 8 units. No, recrossing the spleen channel 8 units above the medial malleolus. So 8 soon above the medial malleolus. And thereafter running posterior to that channel over the knee and thigh. Winding around the genitals, the channel now will enter the lower abdomen where it meets the conception channel or the Ren channel at Ren 2, Ren 3, and Ren 4. Before skirting the stomach and joining with its associated organ, which is the liver, and connecting with the gallbladder. Then the channel continues upwards across the diaphragm and costal region, traverses the neck posterior to the pharynx and enters the nasopharynx, connecting with the tissue surrounding the eye. Finally, the channel goes up across the forehead and then to meet the Du channel at the vertex. What do you call this point? Du 20. Then a branch separates below the eye and then it circles the inside of the lips. Another branch separates in the liver, crosses the diaphragm, and then reaches the lungs. This channel connects with the gallbladder. So that's the liver channel. So liver, gallbladder, we all know that. It is also joined directly with the lungs, stomach, kidneys, brain, and other organs. So what are the symptoms associated with the external course of the channel? So headache, vertigo, blurred vision, tinnitus, fever, spasms in the extremities. Now we go to the symptoms associated with the internal organ. Okay, fullness or pain in the costal region or chest, hard lumps in the upper abdomen, abdominal pain, vomiting, jaundice, loose stool because it affects the spleen. Okay, pain in the lower abdomen, hernia, enuresis, retention of urine, and dark urine. Now, the luo channel of the liver, after it separates from the primary channel at liver 5, connecting with the gallbladder at GB40, a branch will proceed up the leg to the genitals. So what are the symptoms of luo channel excess? Colic. Are you familiar with colic? And when you have swelling in the testicles, okay? Or, yeah, orchitis, swelling. Okay, symptoms of luo channel deficiency. There will be itching in the pubic region. So this is the time where you have to do tonification. Next is the divergent channel. So the divergent channel separates from the primary channel on the foot and continues upward to the pubic region where it converges with the gallbladder channel. Okay? So kung nangangatik-antik ka na dito, so think of the liver and the gallbladder. Then finally, we have the muscle channel or the sinew channel. It begins on the dorsum of the big toe, crosses in front of the medial or the internal malleolus, and it ascends along the medial aspect of the tibia, connecting at the inside of the knee. From here, it proceeds up the medial aspect of the thigh to the genitals, where it joins with other muscle channels. So what are the pathological symptoms? So just like the gallbladder, we talk about straining, muscle strain. So strained muscle of the big toe, pain in the area anterior to the internal malleolus, pain at the medial aspect of the knee, pain due to the twisted muscles along the medial aspect of the thigh, especially when you do a lot of, what's this? Workout, too much workout, dysfunction of the genitals, impotence from sexual indulgence. So can you imagine? Sexual indulgence can lead to impotence. Contraction of the genitals if injured by cold, flaccidness if injured by heat. Okay? Now let's discuss the overview of the points. Tonification point is liver 8, sedation point is liver 2, Harari point is liver 1. So for liver 2, we use this for liver fire. So when you have liver fire, definitely magkakaroon ka ng bitter taste, and you can actually see the eyes are blazing red. Okay, excess, yin normal, yang excess, excessive menstrual flow, stagnant, excess heat, hypertensive headache, or headache with lots of heat and angry. Okay, liver 3, we use liver 3 to drain the heat, and then this is the most common channel point for headaches. Yin deficiency, yang shang, so yin deficiency, empty heat, strong calming effect on the nervous system, excessive bleeding, blood storage problems, more for regulating menses and cycles. Liver 4 is for those with leg circulation problems and hepatitis. Liver 5, genital problems, gynecological problems, and herpes. Liver 6, when you have acute hepatitis. Liver 8 for herpes or genital issues. Liver 5 is used more. Liver 8 is more cooling, nourishing. Liver 5 is more dispersing. Liver 13 is the front view of the spleen. Liver 14 is the front view of the liver. Okay. Now let's call on, so I think the questions are very easy. Sino pa ba hindi ko pa naririnig? Okay, let's call on Sir Darwin. Would you like to try? Good evening, Sir Darwin. Mukhang di yata. Okay. Okay, let's call Sir AK. Sir AK, good evening.
Doc, good evening po.
Okay, answer 1 to 7, please. Ano answer mo for liver 2?
For liver 2, my answer, Doc, is letter C. Drains liver fire, hypertensive headache, abnormal uterine bleeding, spread stagnant chi and blood.
Liver 3?
Liver 3, my answer, Doc, is letter B. Pacifies liver, regulates blood, headache, vertigo, irregular menstruation, insomnia, nervous anxiety.
Okay, how do you decide which point to use? Liver 2 or liver 3? What is your barometer? Di ba? Halos magkapareho. So
Yes,
when do
Doc.
you use liver 2? When do you use liver 3? Using your own, based on your experience.
Usually, Doc, ginagamit ko yung liver 2 once na meron siya sa diagnosis ko na liver yang rising.
Di ba,
Yung
liver, mas grabe pa sa liver yang rising. Namumula na, bitter taste, di ba?
yes, Doc.
So kung stress na stress lang,
Medyo ano kasi, Doc, yung liver 2 sa mga patient, masakit po ito, Doc, eh. That's
yes,
why
masakit.
ginagamit lang talaga ito kung kailangan, eh. So if kaya naman sa liver 3, liver 3 na lang. Kasi painful po yung liver 2, Doc. Honestly.
Did you consider using liver 2 on the ear?
Hindi ko pa siya, Doc, natatry.
You try it. It works the same. It works faster. Nawawala yung galit. Okay.
Sige, Doc.
Okay.
Yung pala, baka mas hindi masakit.
Yes.
Opo.
By the way, for those who are not very familiar, what you see on the chart, the ear chart, those are actually tonification points. So you still have to study the point categories. So you need to know when to sedate, or what is the sedating point, what's the tonification point, ano yung leu-connecting, what's the she cleft, yung mga ganon. So I'm not sure if you have come across the ebook that we have shared. I think it was last year. No, okay. That was the book by Barr, B-A-R-R-E. Okay, number 4. Okay, liver 4. What's your answer?
Liver 4, Doc. My answer, Doc, is letter D. Spreads liver chi, hepatitis, urinary retention, and leg circulation.
would you consider using liver 4 pag merong varicose veins? Like meron tayong, di ba, we have people who use work, medyo nakatayo lang.
Mhm.
Did you have an experience?
Hindi pa, Doc.
Wala pa.
Hindi pa. Pero possible, Doc. Pwede to.
Okay, bakit
Let's say,
nagkakaroon ng urinary retention ng isang taong merong liver issue?
usually, Doc, di ba nanggaling sa ano to? Nagkaroon ng liver chi stagnation to
Okay.
before nagkaroon ng retention. So,
So-
mga tumagal ito ng tumagal, nagpatong-patong yung kanyang mga issues.
Okay. So, related sila. So, what do you think is the primary reason why pwede natin gamitin ang liver 4 sa isang kidney issue? Urinary retention. Ibig sabihin, hindi lumalabas yung ihi.
Yes,
So,
Doc.
kasi meron, yeah.
Responsible kasi, Doc, 'di ba, ang liver channel dun sa proper flow ng chi natin sa katawan. If yung pag-spread ng chi hindi maayos, affected niya lahat eh. That's why very important yung pag aayos o pag dredge nung flow ng chi sa katawan natin, and that is the liver function.
And how do you classify liver 4?
Liver 4, Doc, is metal points to, Doc eh. It is Jing River.
Jing River. Kaya
Yes, Doc.
ano, at saka ang liver and kidneys talaga, they have a very mutual relationship, 'di ba? Nagtutulungan. In fact, kailangan po ni kidney. So, being a Jing River point. Okay, anyway, we'll talk about Jing River point next week. Okay. Anong function ng Jing River? Okay, let's go to liver 5, number 4.
Liver. My answer, Doc, for number 4, liver 5 is letter A. Spreads liver chi, dump heat in the lower burner, endometritis, hernia, and orchitis.
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 Huh? So you have to be very familiar with I hope you don't mind. Okay. And I
Okay,
would
Doc.
like all of you to already be very familiar with medical terms. And you can Google the pronunciation. There's so many materials on the net. Okay, what is the classification of liver 5? Bakit siya maganda for spreading the liver chi?
Liver 5, Doc, is low connecting
Okay.
point.
Yeah, okay. So ibig sabihin, nai-impact niya yung gallbladder, yung yang component. Is it
Yes,
correct?
Doc. Connecting the yin-yang channel organ.
Okay. It tonifies the yin, sedates the yang. Is it correct?
Yes, Doc. Yes, Doc.
Kasi you have orchitis. Orchitis. Oo. Yung nagsuswell. Okay. Let's go to number 5, liver 8.
Okay. Liver 5, Doc. Number 5, liver 8. My answer, Doc, is letter F. Benefits bladder, nephritis, vaginitis, prostatitis, herpes, irregular menses.
So,
Liver 8 is a water point, Doc. Halsey point.
Yeah. C point. Halsey point. So, kaya napaka-effective niya for swelling, vaginitis, nephritis, and also na mayroong mga dampness, no?
Dampness.
Yeah, okay. Let's go to liver 13.
Liver 13, Doc, my answer is letter G. Disperses cold yin organs, enteritis, vomiting. Absorption of food and fatigue.
Liver 13 is the front view point of what?
Front mo point, Doc, of the spleen channel.
Very good.
Spleen.
About liver 14.
This is the front mo point, Doc, of the liver. The liver 14,
Okay.
Doc.
Why are they so close together? Does this have a significance? Are we, is it safe to say that pag may problema tayo sa liver, it can also affect the spleen? Or if we have an
Yes,
issue with the
yes, Doc.
spleen? Okay.
Usually, Doc, di ba, pagka affected yung liver, usually tinatamaan din ang natin, spleen. Usually, yun yung common eh.
So, paano mo na-assess na maganda yung ginawa mo using the pulse?
Using the points, Doc. Usually, yung effect, Doc, doon sa tao.
Okay.
Mm-hmm.
So, talking about pulse diagnosis, like when you are, di ba nasa middle siya? The middle.
Apo, Doc. Apo.
One. Okay. Ano usually ang scenario? Di ba karamihan ng tao mayroong liver chi stagnation? Does it also mean that it can impact the spleen? So if so, what is the possible pulse picture we can expect? Take for example, what will happen? What do you expect to find in the liver pulse? And what also, okay, yung mga stress, di ba pag stress affected the spleen? Di ba?
Yes, Doc.
Okay, so my question is, what do you expect to find in the pulse picture of somebody who is so stressed, so mayroong liver chi stagnation? As you mentioned earlier, it definitely affects the spleen and also the stomach, no? Sometimes. So my question is, how are you going to monitor that using the pulse?
Oh. Is it, Doc, wiry?
Wow, ang galing naman. Grabe. And then what about the spleen? Will it also be wiry?
Yes, Doc.
Are you sure?
Same.
Okay, whatever. Okay, so ano mangyayari? Are you going to have excess conditions or deficiency? If you have a wiry pulse, what is it? Is it excess or deficiency?
Wiry. Oh.
Wiry. Parang string ng violin. Long, slender, taut. Okay, anyway, sige. Parang did I stress you? Alam mo yung sagot. So try to practice doing this. You will be amazed. This is actually the best way. Pagalitin mo muna yung pasyente, Joe. And you will see. Okay? So usually pag kasi it's a different story when all the pulses are wiry. No, it's a different scenario. So, but if it's only the there are some patients, even the lung pulse is wiry. And normally it should be soft, no? The lung pulse. So kung wiry na lahat, no, including the lungs, then that's another story. So most likely depressed yung pasyente. Di ba pag galit ka, depressed ka din?
Yes,
Okay.
Doc.
Thank you very much. So we're
Thank you,
now,
Doc.
ano answer mo sa liver 14? Did you answer it already? Yeah, I
Yes,
think.
Doc.
Okay. Thank you very much. Excellent job, Sir AK.
Thank you, Doc.
You knew it. Okay, thank you so much. Keep up the good work. Okay, I shall call a... Sino ba tatawagan ko? Can I call on Miss Baguio, Ma'am Janine Chen? Chan, sorry.
Naku, Dok, wala pa ako alam.
Ay, sige, nag-look pa, sorry. Sige, I'm sorry. Sige lang, okay lang po. Thank you for your honesty. But alam mo yan eh. Would you like to try? Sige, wag na lang. I won't push the issue, but I expect you to be, to start studying tonight. In a short while, we're going to send to you the email, and I hope all of you, because we're going to end early, before 8 o'clock, mag-8 na pala. So you'll have time to study the notes. So
Yes, Doc.
yes. Are you excited? You should be excited. Ay, parang,
Nervous nga, Doc. Nervous.
why should you be nervous? If you're nervous, it will affect your brain. Okay. Let's go to let me see. Yeah, Mom Darlene, Federico. Can you answer all the remaining questions? Mom Darlene,
Yes,
evening
Doc.
po.
Good evening po. Good evening, everyone.
Hearing your voice, alam ko na you have prepared for this. Okay. Number 8, sedation for the liver.
Number 8, sedation point for liver is liver 2. It's
Very good.
Ying spring fire.
Yes. Alarm point or front view for the spleen.
Liver 13.
Very good.
Also an influential point for all the yin organs.
Wow. What does it mean? Like, what is an influential point or Huey meeting point? Or gathering point?
Influential.
So, ibig sabihin, if you want to impact the yin organs, di ba? Yung ba yun?
Opo. Opo.
Wow, ang galing. I presume you know how to locate this, di ba? So next week, we're going to really study, starting next week, the location anatomically. And we hope, let's all pray that we can convince Dr. Gavino to handle, would you like that? To handle the practicum, di ba? Gagamitin natin yung models doon sa lamp office and as well as the human body, the real human body. Okay, number 10, alarm point for the liver.
Liver 14.
Very good. Meeting point for all yin organs. I think you answered this already.
Yes. Po.
Mm-mm.
Number 12, tonification point for liver is liver 8. It is an pussy water.
Okay, very good. And number 13, 2 points to be used cautiously in pregnancy.
Liver 2 and liver 3.
Very good. Wow. Well reviewed, well studied. And the luo connecting point of the liver.
The dual connecting point of the liver is liver 5.
Okay. And the easiest, the points used before
Dito po ako nag-umpisa, Doc.
okay.
Liver 3, LI4.
Okay, thank
Puro
you
yan lang
very
yung alam
much.
kong tusukin dati.
Wow, you all did well, except for somebody na nagkaroon ng anxiety. Sir June, bawal maging magkaroon ng anxiety reaction.
Thank you.
Bawal. Okay, so thank you so much. And I hope all of you are excited for next week. And at this point, I would like to welcome a very special guest who came all the way from Maryland, USA. He has practiced for 20 years in the States. And I think right out, I think he will tell you about himself maybe when he decides to. Okay, I have good news for all of you. Are you all excited about doing acupuncture on pets?
Yes, Doc.
Or will you be excited more if you do acupressure on dogs? And would you want to be certified by an international practitioner?
Bring it on.
Hindi ko mahilig sa aso, sa mga cats. Okay. Meron lang tayong mga requirements. If you want to be certified, I think, if I'm not mistaken, you need 150 hours for acupuncture for pets. But I'm not so sure about acupressure. So ako naman, I think it would be safer to, like, especially if you are a massage therapist, diba? If you have a patient who really likes you and like the whole family will, are your clients, no? Diba? Sometimes they have pets. Diba maganda if if you try to acquire more skills? Are you excited? Okay. I don't know if Fred is going to like the idea that if I tell him he loved the Philippines so much, so he decided to migrate to somewhere in the Visayas. Fred, good evening. Can you? Yeah,
Good
that's
evening.
good evening. Yeah.
Nice
So
to see you all. Thank you for inviting me today.
yes, can you give us the impression? Yeah, we know that the standard of acupuncture practice in the States is quite different from the standard here. So, would you like to tell us more about, like, it's our first time to hear about acupuncture for animals. And what is the, like, why did you decide? Maybe very briefly, can you tell us what made you decide to specialize in pet acupuncture or veterinary acupuncture?
Well, I had dogs. I had a bunch of dogs back then, and so I was interested in in first of all treating my dogs. They were older dogs with who were getting multiple health issues. So that was one motivation, but also just while I was in school, I had heard a lot about pet acupuncture because I was in one of the only states in the U.S. that had worked out an agreement with the veterinarians to allow non-veterinarians to do acupuncture. So I'd heard about this for many years and encountered a few acupuncturists who went through that training program in my state. So that was one of the things that got me interested.
Wow.
But when there's more to that story, but
Yes.
when we I
When we
don't know
meet,
if you had it announced to people, but
not yet.
yeah, in early February we're going to do an introductory
Yes.
seminar about animal acupuncture. Just a brief introduction we'll
An
do then,
orientation probably on
yeah.
maybe we will get to know you more. And
Yeah, and I can tell more about that story, but
okay.
To answer your question, I grew up with dogs and cats and ducks and rabbits and snakes and just about every creature iguanas. So I knew even before I went to acupuncture school that I wanted to treat animals once I graduated from the people program.
Okay, so thank you very much, Fred.
Yeah.
And how do you find the Philippines so far?
I'm loving Dumaguete. Sorry about the noise. I've got a pack
It's
of
okay. Yeah.
dogs and roosters right out the window here.
Okay. Thank you so much. So let's ask
Yeah.
2 or 3 people. Okay. Who are dog lovers here? Are you looking forward to? Okay, let's start with Miss Baguio. I'm not so
Sorry,
sure.
Doc.
Miss
Not
Janine,
really.
do you like dogs?
No, Doc. Sorry. No animals here.
Yeah, I remember you have no. But would you like to take care of animals, like do acupuncture or acupressure on animals?
No, Doc. Pass.
Okay.
I like
Okay.
I like her honesty. I admire that honesty. Yes.
Yeah. So let's ask. Thank you, Mom Janine. Yeah, I noticed. By the way, for the information of everyone, Mom Janine owns a very beautiful hotel. It's very cozy, somewhere in Baguio. Okay. And she has one of the best coffees in the world. So for those who are into coffee. Okay. Let's ask June. June Azariel. Are you excited
Doc.
about pet acupressure, acupuncture?
Yes, Doc.
Do you like dogs, cats?
I have lots.
Like how
I think 30.
30? Oh, that's crazy. Like 30 cats?
No, no dog. Maybe 20 dogs and 10 cats.
Okay, 20
Wow.
dogs is too much. Okay.
Wow.
But
Wow.
I tried laser acupuncture in my dogs, but I'm not familiar with the needle when it comes in the that kinds of methods.
Of course, because it's the
And
first
what
time in the Philippines. So, ano, like
what's your name? I didn't catch
Azariel.
Azariel. Okay.
Doc Fred,
Wow.
you already meet me or rather talk to me before. If you remember,
Oh,
I'm from the
okay,
You
laser.
show your
okay.
face, June.
Okay, Doc.
But
And you also
I
want to
don't
see
think you
your
told me
dog.
you had 30 pets. I don't think you told me you had 30 pets back then. I would have remembered. That's
So are you
impressive. Okay,
excited?
we'll have to talk some more.
Yeah.
Okay.
Would you do you think it will make an impact if we will allow Sir Fred to give training on pet acupuncture?
Is that same with the points? Just like, for example, for gates, like that? No.
I think
I'm sorry, say again. I couldn't hear you, Jim.
yeah,
I
he
mean,
was asking. Yeah, sure.
okay, Doc. You explain it.
Yeah, he was asking if the points that we use on humans are the same points that we use on animals.
Yes. Yeah, the points are the same. However, you can imagine that some points are going to be preferred over other points because of you're working on a dog and they're not going to be happy about some of the point locations. So part of the training is learning which are the safer points and the easier points to get effective results with animals, since you may not have access to all the same points that you would with a human.
Okay, thank you very much. Okay, let's ask another one. Miss Darlene, do you like dogs?
My family have lots of animals, dog. During the summer, I cannot play with them because I have allergy with the flea. The flea is um,
Okay.
biting me. But I love them, especially cats.
So would you like to train on how to? I think there are
Yeah,
techniques that
it's
we have to
interesting.
learn.
It's and also first time to introduce here in our country. So
Yes, in the
I
Philippines.
would love to have to be one of the first ones.
Wow, did you hear that, Fred?
Yeah, I just want to say I love cats. I've been a cat owner too, and I really enjoy working on them. Cats pose some significant challenges that we may not see with dogs. So we're probably going to do a separate cat training for those who have already done the dog training.
Okay.
So that's something to look forward to down the road. But cats require special screening to make sure they're going to be good, safe patients, as you
Yes.
can imagine. Yeah.
Okay, so we're looking forward to the lecture that will be on February 2. That will be a Friday. We'll post it on our group chats, and it's a free introductory or an orientation on, yeah, of course, we'll get to know more about Fred and his practice in the States.
And
Am I
I
right?
would just add I would just request that people come prepared with questions, because that will make it a more interesting meeting for everyone. If you have questions about treatment in general or your own pets, and
Yes.
it's a good time to ask.
Because the challenge here is it possible for the animals to know, or will they know if the practitioner doesn't really like animals? Will it impact the kind of treatment that they get? What I'm saying is, would it not be a challenge to obviously for someone who doesn't like animals, they wouldn't want to to do acupuncture, but there may be some people who may want to do acupuncture for additional skills, yet they don't own dogs. Would that make a difference? Because from what I heard, I've experienced this. A dog could tell if you are a dog lover. It can even tell if you've been eating dog meat, just like in northern part of Luzon. And they would,
Baguio.
they would know, nagagalit, di ba? And
Amin yun, Doc.
so I'm
Baguio.
sure, yes, so that's something that we need to look into.
That's it's a very good question. I mean, everybody that I know who treats animals in the U.S. are, they're animal lovers. And yeah, they may have been nervous in the beginning treating animals, but I don't think the nervousness is not a reason, to avoid learning. But if you're not an animal lover, you may want to think twice about the training. Yeah. But
So,
I trained on horses because it was required in my training. Horses were a required section of the training. I did not grow up around horses. I didn't have horse experience, and I was never comfortable with horses. I'm not I think they're beautiful. Don't consider myself a horse lover in the way that some of my friends are crazy about horses. So I chose not to treat them because I never got 100% comfortable with them. Never felt 100% safe, and that's a problem with horses because they can really sense it. If you're not a horse person, they know it.
oh, okay.
Yeah.
So we're looking forward to that. That would February 2, mark that. We haven't posted it on social media yet, but for those who are to this kind of thing, this can be an additional skill that will really make you more productive, if you know what I mean. But so, Sir Michael, do you have a question? Maybe we can. Sir Michael, meron ka ba itatanong?
Good evening, Doc. In my end, some maybe example like phlegms. If the dogs have phlegms, do we still apply the treatment as we go? The treatment of acupuncture, like phlegms.
Phlegm?
Yeah.
I'm sorry, I have to unmute. Were you asking if the dog has phlegm?
Yes. Sneezy, something like sneezy. So do you use acupuncture and also use also herbs sometimes, or you just plainly use acupuncture?
Acupuncture and herbs.
Okay.
Yeah. Just the same as with people.
Okay. That's all my questions.
You know, the one difference between practitioners in the Philippines and practitioners in the States are that they are very knowledgeable about herbs. So my question is, Fred, where do you source your herbs?
Yeah.
So this is a good question because in the U.S., acupuncturists are not licensed or able to prescribe herbs for pets.
Okay.
Only a licensed veterinarian can do that, and only if they've had holistic herbal training.
Okay.
So although, I might give herbs to my own pets, I never prescribe them in the clinic.
Yes.
Okay,
So the standards are quite high in the States.
I see.
Yeah.
So
Also,
one doesn't have to be a veterinarian to learn acupuncture for pets, right?
What's that?
Does
Say again?
one have to be a veterinarian or a veterinary physician for us to learn acupuncture, or it's not necessary?
If you don't live in one of the 3 or 4 states that allows acupuncturists to treat animals, then it just depends on what state you're in and what the particular guidelines are. You may be able to practice under the direct supervision of a veterinarian if you've had the 150-hour training. But I believe there are some states where you wouldn't even be able to do that. You would have to be a veterinarian. So it varies by state.
So in the Philippines, there's no one who is even practicing. It's my first time to hear someone practicing acupuncture on animals.
Yeah. Very interesting.
Yes.
Yeah.
Are you excited, Sir Michael? Would you be interested?
Yes, too. Me too. I'm a animal lover too.
Yes.
That's
Okay,
great.
that's good. Okay, we will have one. Does anybody have a question? Anybody would like to ask? Don't be shy.
We can give out access to my email, and if anyone has particular questions that you want me to address on February 2nd, you're welcome to email me, so I'll be sure to include them.
Sure. I hope for those who are very interested, you can invite also your friends, and let's make this project a huge success. Only for those who are interested. Okay, I think Azariel has a question. Can you show your face, June?
Okay. Dr. Fred, I have a question. Rather, my question is, do you have experience of being bitten by animal while during the acupuncture or needling technique, rather?
What was the question?
Do you have experience beaten by an animal during the
Okay.
acupuncture?
Bitten. Yeah, okay.
Kasi Doc, paano yun?
Your mic is muted.
I'm sorry.
Okay.
No,
that's a great question. I've been working on animals for 19 years, and I've never been bitten. So if that's a concern or fear that people have, please know that a very important part of the training is learning how to both keep the animals safe, yourself safe, and the owners who are in the room with you, helping you during the treatment. So learning how to navigate those situations where you have an anxious dog, and even more importantly, learning to screen before with the proper questions before they ever get in the room with you is essential. So those are all things that we would cover in a training.
Okay.
Okay.
Are you happy with the answer, June? Excited?
Yes, Doc.
Can you tell your
June, just to clarify, I don't think any of my colleagues who took the training with me have been bitten, and if they have, it's just been maybe a warning bite. Yeah.
So how not to be bitten by an animal?
Yeah, that's an excellent
training.
question. Yeah.
Okay, that's good. Can you also convert those who don't like animals to like animals? I know it's a silly question, but I think we have. Okay. So, as they say, dogs are man's best friend. And that's why Sir June Azariel has 20 dogs and 10 cats. Okay. So,
June, I want you to send a photo. I want to see a photo of all of you together.
okay. So, for those who are interested, would like to make friends with Fred, kindly message him. Can you tell them how to contact you, Fred? Or you have a Facebook page? Okay, anyway, so we hope that you can invite more people.
I will give you my email, and you can send it out to the whole group, so they'll have it.
Okay, can you type it on the chat box now?
Sure.
Okay, so this is something that we are very excited about, and this can mean more earning potential for those who are, if I'm not mistaken, you'll be also offering acupressure for pets, for animals, as well as acupuncture for those who are so serious. Okay. Andyan na. So that's the email ad of Fred's.
Yes.
So can you join us again next week, Fred? Wednesday, we're going to start a new module. It will be basic anatomy and physiology and the 5 shoe points.
Yeah, that's great.
Yeah,
I will see you then.
It's we're very happy that you joined us, and we hope that we can have a very strong partnership with LAMP and whatever organization you're thinking of coming up with. And I'm sure we can reach out to more animal lovers out there that may not necessarily want to learn acupuncture, but again, as animal lovers, they would want to make sure that the health and well-being of their animals is now their top concern. And that's something that everyone is so excited about. Okay? Animal lovers. Thank you so much for your time, Fred. Thank you,
Great,
everyone.
thank you. Nice to be with you all.
Proud, of all your. How do you find our practitioners, as students, Fred? Like,
I'm really impressed with everybody's knowledge of, so after you've been out of school for 20 years like me, all that information, it's really helpful to sit in your class and review it, because it's hard to retain all of those details and stay fresh.
Do you think what we've taken up tonight is something that every practitioner should be, should have knowledge about?
Yeah, these are all very these are very practical points. I mean, especially the points that you're going to be relying on in the clinic every day.
Okay.
So knowing which points on the are most commonly used on the liver meridian or the gallbladder meridian is essential.
Mm-hmm. So, for the information of everyone, Fred has been practicing acupuncture for 20 years. So that speaks a lot about his experience in Maryland. So the rest of the details you will find out soon when you attend our free orientation on pet acupuncture on February 2. Are you all excited?
Okay.
Yes.
Yes.
Okay, Dr. Sum, let's end with you. Dr. Sum holds a PhD. He's also a doctor of a naturopathic doctor, and one of the best students we have. Dr. Sum.
Yes, thank you so much. Hey, the animal acupuncture is really a very interesting topic, and I got one real question for you, sir, or Fred. By the way, we are already friend in Facebook, on my other account, some reason. Um, like I had a pet once, but sad to say, it's already a dead one. The Chow Chow.
Oh, expensive.
Yeah, yeah, the
Royal
Chow Chow.
blood. Royal dog.
Yeah, but the Chow Chow is so dominant. It's I think it's a wood type if it's it's a pet that I don't know how to manage that one because it's really irritable, something like that. If you touch that
That's
chow chow from the back, it will bite you.
Oh my
that's
God.
right. No, that's a great example of a conversation that you have to have with the owner before they show up with their dog, because you're absolutely right. That breed does not always make a great patient. So and I think in my history, maybe I've only treated 2 or 3, and that was a long time ago. For that reason. Plus, they're not that common in the U.S. You don't see them a lot.
But we do have a lot of techniques on how to handle that kind of a dog.
Yeah. If there are techniques, but the best technique is always making sure that they're doing the screening before they show up.
Okay.
Because often when you talk to the owners, you find out some of the history, and you have to weigh the risk versus benefit to not just yourself, to yourself, but the owners, because the owners can get bit just as easily in a session. So yeah, that's a great example of how important it is to learn how to screen and the right questions to ask before you get into a situation that's dangerous.
That's
Okay. So are you going
Yeah.
to have another chow chow?
No, Doc, based on my experience, I just want to let everybody know that Chow Chow is just like a liver type, no, a wood type personality.
Aggressive.
And yeah, and also the Chow Chow is weak when it comes to the organ liver. It's very weak.
Okay.
Right.
All right. Thank you so much, Fred, for that information and being part of our assessment tonight. Thank you.
Great. I look forward to talking to you more.
Okay.
All right.
Thank you so much, Fred. Thank you to everyone. You all did well. And are you excited about the new module 5? Yes. So study them now, study the questions, and see you on Wednesday, same time. Thank you so much. Good evening, and please wait for the email. So I believe that you have all submitted your email addresses, or we can, because I think we're ready with the books. There are 25 books. You're all excited, I'm sure. So thank you so much, and stay healthy. And let's start the year with with good attitude, positive attitude, and let's make all those chow chows less violent. And let's explore other possibilities of making a difference in other people's lives. And there are a lot of people out there who I know would love to take care of their pets. Thank you so much for your time. Looking forward to seeing you again next week. Fred, thank you so much. Thank you, everyone. Good night. Bye.
Nice. Bye, Doc.